Today, the topic for discussion is maxillary sinus. In this presentation, we'll be covering its introduction, discovery, definition of maxillary sinus, its development, its proper anatomy, its microscopic features, the functions of maxillary sinus, diagnostic evaluation, and its associated pathologies. Moving on to the introduction. The paranasal sinus are air-containing bony spaces around the oral cavity. Actually, there are four pairs of paranasal sinuses bilaterally, and the four pairs include maxillary sinus, frontal sinus, ethmoidal sinus, and the final one is sphenoidal sinus. And it is also called as antrum of high mode. And the maxillary sinus is considered as the largest paranasal sinus, and that is the importance of the maxillary sinus. I repeat, there are four pairs of paranasal sinus, and the four pairs are maxillary sinus, frontal sinus, ethmoidal sinus, and sphenoidal sinus. And the maxillary sinus is also known as antrum of high mode, and it is considered as the largest paranasal sinus. This is a picture which shows the frontal and the lateral picture showing frontal sinus, ethmoidal sinus, sphenoidal sinus, and the maxillary sinus. This is a coronal cut which shows the frontal sinus, orbital region, ethmoidal sinus, and the maxillary sinus. You can see in this picture the maxillary sinus, which is the largest paranasal sinus. Now let's see the discovery of maxillary sinus. It was first discovered and illustrated by Leonardo da Vinci, but the earliest attribution of significance was given by Nathaniel Highmore. That's why it is known as antrum of Highmore. The British surgeon and anatomist who described it in detail in the year 1650. Now let's see what is the definition of maxillary sinus. The maxillary sinus is defined as a pneumatic space that is lodged inside the body of maxilla and that communicates with the environment by the way of middle meatus and the nasal vesticle. The development of sinus, as you can see in this picture, at the birth it is having a tubular shape. At the childhood, it attains an ovoid shape, whereas in the adult, it attains a shape of pyramid. The development of sinus at the birth is of tubular shape, whereas it regains or it attains an ovoid shape in case of childhood, and whereas in the adult, it attains a pyramidal shape. And the anatomy of maxillary sinus is actually a pyramidal shaped cavity within the body of maxilla. It is clearly depicted in the picture that the boundaries of the maxillary sinus and the apex is facing toward the zygomatic process of maxilla, whereas the base is at the nasal surface of maxilla. The roof is orbital surface of maxilla, whereas the floor is alveolar process of maxilla. These are the boundaries of maxillary sinus. Repeating, apex is facing towards the zygomatic process of maxilla, base is facing towards the nasal surface of maxilla, the roof is facing towards the orbital surface of maxilla, whereas the floor is directing towards the alveolar process of maxilla. The anterior wall is related to infraorbital plexus of nerve and vessels and the origin of muscles of upper nerve, whereas the posterior wall is pierced by posterior superior alveolar nerve and X vessels. Now let's see what are the arterial supply of maxillary sinus. There are four major arteries which supplies the maxillary sinus, which includes facial artery, maxillary artery, infraorbital artery, and greater palatine. These are the four arteries which supply the maxillary sinus. Now let's see the venous drainage. Anteriorly, it drains in the sphenopalatine vein, whereas posteriorly, it drains through the pterygoid venous plexus, which again drains into the facial vein. And we should know that the pterygoid plexus communicates with the cavernous sinus by means of emissary veins. Anteriorly, it drains to the sphenopalatine vein, whereas posteriorly, it drains into the facial vein through the pterygoid venous plexus. The pterygoid venous plexus also communicates with the cavernous sinus by means of emissary veins. And about the nerve supply of maxillary sinus, the major nerves which supply are of five types. The first is anterior superior alveolar nerve. The second is middle superior alveolar nerve. Third is posterior superior alveolar nerve. Fourth is infraorbital nerve. And the last one is greater palatine nerve. These are the five nerves which supply the maxillary sinus. Again repeating, anterior superior alveolar nerve, middle superior alveolar nerve, posterior superior alveolar nerve, infraorbital nerve, and the greater palatine nerve. In this picture, you can see the branches of trigeminal nerve which supplies the maxillary sinus. That is the posterior superior alveolar nerve, middle superior alveolar nerve, anterior superior alveolar nerve, infraorbital nerve, and the greater palatine. Now about the lymph drainage, it drains to submandibular lymph nodes, deep cervical lymph nodes, and retropharyngeal lymph nodes. That's all complete the anatomy of maxillary sinus. Now let's go into detail about the microscopic features or the histological features of maxillary sinus. Actually, three layers surround the space of the maxillary sinus. Those include epithelial layer, basal layer, and subepithelial layers, including the periosteum. The three layers are epithelial layer, basal layer, and subepithelial layers, which includes the periosteum. And the functions of maxillary sinus includes warming of inspired air. And the next is humidification of dry air. The third is lightening of skull weight. Fourth is resonance of voice. Fifth is filters debris. Sixth is accessory olfactory organ. The seventh is protect the skull from mechanical shock. Eighth is production of bactericidal lysozyme. Again repeating the functions of maxillary sinus, the warming of inspired air, humidification of dry air, lightening of skull weight, resonance of voice, filters debris, accessory olfactory organ, protects skull from mechanical shock, and finally the production of bactericidal lysozyme. Now the diagnostic evaluation of maxillary sinus. First, we should take a detailed medical and dental history, and then we should proceed with the clinical examination. In clinical examination, we proceed or we forward with the inspection, palpation, percussion, and trans illumination. And then we proceed with the radiograph and other adjuvant screening methods like ultrasound, CT scan, and magnetic resonance imaging. And also we make use of endoscopy for the diagnostic evaluation. First, with the help of case history, Second is clinical examination, and then we proceed to the radiographs, ultrasound, CT scan, MRI, and the final with the endoscopy. And in palpation, tapping of lateral wall of the sinus over the prominence of cheekbone and palpation intraorally on the lateral surface of maxilla between the canine fossa and the zygomatic buttress. If there is fluid accumulation or in case of maxillary sinusitis, the patient will have a pain over the palpate region. In case of transillumination, and it is done by placing a bright flashlight or fiber optic light against the mucosa on the palatal or facial surface of the sinus and observing the transmission of light through the sinus in dark room. And this method is known as transillumination. Mostly it is done using fiber optic light. Or in case of rural area, we can proceed with bright flashlight as well. In radiograph are mainly of intraoral and extraoral methods. In intraoral methods, we proceed with normal intraoral periapical X-ray, then occlusal X-rays, and then lateral X-rays. Whereas in extraoral methods, we proceed with panoramic X-ray, Waters view, submendovertex view, or posterior-anterior view. These are the view of radiographs that are used for diagnostic evaluation of maxillary sinus. Now, the advanced screening methods, right, like CT scan and magnetic resonance imaging. It provides multiple sections at different planes, and it provides high resolution images, and they are considered as non-invasive techniques. Hence, you can see in this picture, it shows the normal maxillary sinus, whereas the pathology. This can be clearly made out in case of CT scan and magnetic resonance imaging. The only problem with the CT scan and the MRI is it is slightly expensive. And about the ultrasound diagnostic evaluation of maxillary sinus. And it was introduced by Landman in 1986, and it is also a non-invasive method, and it is safe, and it provides quick results, and usually the main method by which it occurs is it uses ultrasound waves which are generated by the probe. You can see in this picture how the ultrasound scanning is being done and the image of the maxillary sinus. Left side is a normal, right side is a pathology. And with the endoscope, it allows direct visualization in inaccessible areas, such as the maxillary molar roots that are left behind. Usually in case of extraction of maxillary molar, first molar, there is high chance of fracture of the maxillary first molar roots, and the root, if we use injurious force, it will be pushed towards the maxillary sinus. In those cases, we use endoscope for the proper visualization of the maxillary roots in the maxillary sinus. Now let's see the associated pathologies in the maxillary sinus. The basic ones are the developmental anomalies and then the infections, usually sinusitis. The sinusitis is actually mainly of two types: acute maxillary sinusitis and chronic maxillary sinusitis. The pathologies also include dental implications of maxillary sinus.